like me and think of questions after the event or want to contact me for any other reason too, that's totally fine. And I'll also put it into the chat too, so you have that easily accessible. Please feel free to eat too and stretch, keep your video on or off. I know that a noon hour training, sometimes you need to do things. Chime in over the chat. So I also want to acknowledge that I often present in a university-oriented space. So some of the things that I do might seem a little bit less directly applicable to a healthcare setting. I do try to make this as interactive as possible. So I'll try to facilitate some discussion, ask some questions, try to make a 2-hour Zoom session feel a little less remote and just like you're staring at your screen for 2 hours. And I also want to introduce my pup Eli really quick. Eli, I use they, them, their pronouns for them and also he, him, his. And I do that just for practice for myself, using different pronouns and also so folks can hear pronouns too, if they're not as familiar with using non-binary pronouns too. So just a quick tip there, if you want practice, pets are a great way to practice with pronouns because they don't really get offended when you misgender them. So before we begin, I mentioned that I'm the Gender and Sexuality Program Advisor. Does anyone want to try to toss out a definition for either gender or sexuality?
Could you ask that question again? I'm not quite sure I heard you clearly.
Yeah, so I mentioned that I'm the Gender and Sexuality Program Advisor, so just to make sure we have a sense of shared understanding, I asked if anyone wants to define either of those terms.
Well, gender is how you identify yourself as either, is a self-identification, I believe. Would that be accurate?
It's, yeah, mostly accurate. I would also say that there's a lot of cultural norms associated with gender and societal expectations of how people are supposed to act based on those categories that we're often placed in. Gender is also not a binary thing. Sorry, I think I interrupted someone.
No, I was just, I think I said thank you or something.
Gotcha.
Thank you.
The lovely aspects of Zoom. How about sexuality?
Okay, I'll go again. Sexuality is, I guess I would say there's several aspects of that I would put in the pot of sexuality, both how you define your own sexuality and who you want to be physically intimate with, and how you define that for yourself.
Yeah, I think that's a great definition, Maggie. I'll also say that there's different axes of attraction too, whether it be physical or emotional. And how I like to think about it too, just in my role, is just more broadly thinking about relationships too.
Uh-oh, are you any good at this? Where's my sound? Shit.
Everybody's sound is down in the left-hand corner of your screen.
Put me on.
Mute or unmute.
Speaker. The headphones, no.
Lorraine, we can hear you talking. The joys of Zoom. I will get a little bit more into these definitions later in the presentation too. I just think it's helpful to start with that. And a little bit more broadly, my role on campus is to advocate with and for marginalized students, and more specifically LGBTQIA+ students. So that's a little bit more about my background. And Devin, if you want to switch to the next slide, please. So I like to open space for folks in my trainings to share a little bit about themselves. I think it's a good practice with sharing pronouns. I also like to hear what folks are wanting to get out of any trainings that I do. I can't always promise that I'll be able to cover it all, but I like to try to adapt what I'm presenting on to kind of meet the needs of the space and of the room. This sharing is totally optional. You don't have to share it all. You don't have to answer all of the questions that I have on the slide. Just share what you're comfortable with. And I like to, before we begin, to just kind of start with these shared agreements. Confidentiality and mindfulness of the space. So what's said in this training stays in this training, kind of a general rule. I think it's also important to acknowledge confidentiality, especially when we're talking about LGBTQIA+ identities and kind of reflect and get us to think about where this information might not want to be shared by certain individuals. So whether or not you're just being mindful of not outing people as LGBTQIA+ if they come up to you, and being mindful of the spaces that you're in. Another thing that we like to encourage is challenge by choice. So if you have questions to ask, please ask them, please engage to your comfort level. We just ask that you participate, but also being mindful of growing is challenging yourself too. And I also like to make a note too that for LGBTQIA+ identified individuals in healthcare, challenging and being comfortable is not always a choice. We're not always comfortable in these settings too. So comfort is kind of a reflection of privilege as well. And then finally, listen and ask questions, really emphasizing the listening. And I absolutely welcome any questions that you may have too. And so before I open space for you all to share a little bit with me, do these shared agreements sound good? Is there anything you want to add?
I think they're great. Does anybody else want to speak up about what, about the shared agreements?
This is Vicky, and I also think they're great.
And this is Ruth. I'm just here to kind of improve our space I work at the WIC office in Cheyenne, Wyoming. And so we get some different cases that happen. And so our staff would like to really understand and make everybody comfortable. So that's our story.
Thank you, Ruth.
I'm Lorraine Salino Klein, and I'm a local nurse, and I work at the downtown clinic, and I do a foot business, and I'm here to learn and to be more respectful. As in a different generation, they have a little harder time, so I'm going to make sure I'm making people more comfortable.
I'm Sherry Mccoy. I actually work at the Wyoming Girls School. I've been a nurse for 25 years. I guess I'm here to learn more. I was in the military for 24 years, so I have a pretty good understanding. My daughter's, I guess you would say, asexual. She's more into personality versus heterosexual or bisexual. She's married to another woman. So I have two beautiful, wonderful daughters. And they have a son from her previous relationship. So.
Thanks for sharing that.
Hi, my name is Angela Vaughn. I work at Cheyenne Regional Medical Center in Cheyenne, Wyoming. And Dana Thompson and I, who are both here, are currently working on establishing a health equity committee for our hospital system. And so we are here to just learn more and are really excited for the training.
Awesome, thank you.
Yeah.
I'm the Dana Thompson she was talking about. I work with Angela, and like she said, we're making a health equity committee. So really excited to be here. Thanks for hosting.
Really quickly, so I don't forget, Wyoming Equality is working on a healthcare access project, so they'd be a great resource to reach out to. And you can reach out to me for more information about that, so we don't take up too much time about that.
Thank you.
Awesome, yeah. Thank you.
Does anyone else want to share a little bit about themselves or what they hope to get out of the training? I like to try to challenge myself to provide more silent spaces in case folks need a little bit more time to chime in.
I'm Carolyn Conlon, and I feel that I'm just trying to help the health centers in Wyoming be more inclusive to LGBTQIA.
Thank you.
I can share. My name is Jamie Nipkin. Pronouns are she, her, hers. I work at the Albany Community Health Clinic, and I'm just trying to see if there's other things that we could do to try to make a safe, open space here at the clinic.
Perfect. Thank you. And feel free to chime in the chat too. I'll keep an eye on it. But if no one else is particularly jazzed about sharing right now, we can move on. I will also offer that if you have any questions that I don't seem to answer, please remind me. I tend to get carried away sometimes and forget about the original starting question. So any nudges would be helpful there too. Devin, if you want to switch. All right, so starting out, I think it's really helpful to touch base on terminology just to make sure that we're on the same page here. I like to just give space for folks to kind of look at the slide. I did the thing where you're not supposed to input too many words on one slide. I do that a lot. But are there any terms immediately that stand out to you that you have questions on, that you'd like to explore further? Anyone that you're particularly jazzed about, even just giving a definition yourself?
Oh, I guess I do. I have a question. There was a time, and I'm older, when the term queer was used as a pejorative. Mm-hmm. And now I see it up here. So now it's obviously it's on your list. It's acceptable terminology. How would you define queer?
Yeah, so I'm really glad that you brought that up, Maggie, and I get a lot of questions about the word queer. I think it's really helpful to acknowledge its history, that it was used as a derogatory term and as a slur in the past. For some people, the word queer still carries that resonance and that history, and they don't want to use that word for themselves at all, which is totally fine. I think for many, though, that they find some resilience and resistance in reclaiming the word queer and kind of using it as a way to resist.
Transcend, yeah.
Yeah, resist some of the marginalization of the past and acknowledge that there's ways to kind of reclaim identities and reclaim how people have been treated. The really useful thing about queer is that it can be used for both gender and sexuality. So for folks who want to identify as queer but not really label themselves further, that's a really useful word sometimes. I personally really like to use the word queer. I actually prefer using it over the acronym. For one, it's easier for me to pronunciate and announce. I have some trouble sometimes with enunciation. But I think it's a really good point to acknowledge that for some, providing space for the word queer, it might not resonate with them even if they are LGBTQIA+. So really emphasizing the need to meet people where they're at and using the terminology in terms that they feel comfortable with is something that is really critical and also sometimes challenging to do.
What is two-split spirit? What the slide is very small on my screen. So what is that? Two what? Two spirit, yeah. Two split? What is that?
So it's two-spirit, and it's a really culturally relevant term, and I'm glad that you asked that too, Lorraine. So two-spirit is a term that is only for use by Indigenous communities. So really being respectful of that and allowing only Native and Indigenous communities to identify with that term. It really harkens back to how, for many Indigenous communities, tribes, they understood gender as being more than just two categories of man and woman. And so two-spirit is kind of along similar lines of transgender, as it challenges the alignment of cisgender identities in that sex assigned at birth and assumed correlating with gender. So just really acknowledging that the binary system of man and woman is kind of a legacy of colonization, and as a way to kind of reclaim some of that history and give a word for Indigenous folks to identify with, two-spirit was a term that is used today. But just be mindful of when you're using it and how, if that answers your question, Lorraine. So the biggest takeaways for terminology is just understanding at a basic level the difference between gender identity, sex assigned at birth, and sexual orientation, which I think more and more folks are starting to kind of understand and use it a little bit more in the daily. But sex assigned at birth is male, female, intersex, often correlates to things like chromosomes, sex characteristics, gonads, hormones, but recognizing too that sex is not always binary either. Intersex folks exist, and there are ways that the sex binary just doesn't really uphold or apply in every case. Similarly, the binary doesn't always apply to gender. We have man, woman, non-binary identities too. You can break those non-binary identities down further, but just to realize that for sex assigned at birth, it doesn't always align with someone's gender identity. So someone might be assigned male at birth, but identifies as a woman, so that would be a transgender woman. So just challenging that alignment and recognizing that sex is very different from gender. And it's really critical to make sure that you provide space for folks to identify both, I think, especially in healthcare settings. So I would recommend making sure in forums you have a place for both sex and gender for folks to identify. It just makes it easier for if someone's a transgender woman to identify sex versus their gender. And then sexual orientation, we kind of got into earlier, is just more who you're attracted to, whether that's emotional, physical, and some folks are asexual and don't have much or any physical attraction, but they might have romantic attraction, or vice versa. Folks might be aromantic, so they have physical attraction but aren't romantically or emotionally attracted to folks in quite the same way as we consider it to be normal. So any questions on that difference? I included the gender unicorn because it's a useful resource just to kind of see it all laid out.
That's a good one.
Yeah, it comes from the Trans Student Educational Resource, which is a really great resource just to check out if you want to learn more. It's really centered and driven by transgender students who have created resources that help them increase access to education so that they can navigate school systems better.
Thank you. I like that.
For sure. I also want to note too that, I mean, this goes back to the question that it's Maggie, is that how you say your name?
Yes, yeah.
The question that Maggie had about the word queer is that language is always in flux and it always shifts. So even though this is my day-to-day job and daily work, sometimes I even get a little bit behind how language is used, and it will continue to change too. So just making sure that you're aware of language as it shifts is a really good idea. Also, I would recommend, and I'm going to put a link in the chat really fast, to another great resource that you can check out. It has a glossary of terms here too. It also has information on sexual health, relationships, gender identity, and trans identities. That's a really great resource to check out, but it has a glossary of terms too in case you find you have a question later that you only thought of just later.
I have a question. Are you recording this so that someone who would need to listen to it later could do that? I have a friend who really wanted to come to this and could not. Is that happening? Is that happening?
Yeah, Devin, I'll let you answer this question since you're more that side of things.
Yes, it is being recorded. I will send out a link after it's completed.
Thank you very much.
How about the terms on the top right? Have any of you seen those terms before?
Well, I'd like to say pronouns are like really hard for, because I mean, I have a little, my best friend's granddaughter for 9 years decided she wanted to be a grandson. And boy, her parent, they have no tolerance when I say she instead of, now he wants to, instead of Vita, he's Victor. And it's not intentional, but, for 9 years, and she's 12 now, I'm making that transition. I wonder if there's any other way to help somebody, deal with that.
Yeah.
Or
so he's 12.
What should you say?
Yeah. So you're talking about your grandson?
Yeah. Well, he's my best friend's grandson. So
okay. So
in my family.
Pronoun habit is something that can be sometimes hard to undo when you've had a lot of years consistently using certain pronouns. So I think it's useful to just acknowledge that it's a habit that we have, but habits can be changed. Sometimes it just takes time. The pet tip that I had with Eli earlier, you might want to try changing pronouns for your pets just to have practice. Other ways is that you can journal about it using he, him, his pronouns and calling him your friend's grandson. Journaling kind of helps you get some practice too when you're not actually in real time. And also recognizing that impact over intent is another thing to acknowledge. So while holding space for yourself in that change, just knowing that misgendering does cause some harm. And so acknowledging that when it does happen, it is an important thing to get right for your friend's grandson too. But that you even ask that question just shows how much you do care about getting it right as well. And pronouns can be hard too because we have certain assumptions about what they mean. So when you first meet someone, we tend to automatically gender them and assume their pronouns unless proven otherwise. So one thing that you can also do, and when you're introducing yourself, if you are a cisgender, is just share your own pronouns. It can be really helpful in opening up the space for people to share their pronouns with you too. Especially if you're curious about someone's pronouns but don't want to ask them right away when you first meet them, just share your own pronouns and see if they give you an answer there too.
You just used the word cisgender.
Mm-hmm.
Define that for us.
Yes, I'm glad you asked that. Sometimes I'm really bad at like backtracking to the very beginning of learning about this because I've done this for a while.
Mm-hmm.
So cisgender is a term that we use when someone's sex assigned at birth aligns with gender identity in ways that were constructed as normal. So what that essentially means is if someone's assigned female at birth and they're a woman, then they're cisgender. There's no considered abnormal disalignment there. For someone assigned male at birth, they would be cisgender if they are a man. This is contrasted with transgender identities where sex assigned at birth doesn't align with what we presume to be the alignment with gender identity. So for someone who is a transgender woman, they were assigned male at birth and identify as a woman now and are a woman now. Another thing that's important to emphasize too is that for transgender people, there's no certain way to be trans. There's no requirement that they transition in any way, that they take hormones, that they have surgeries from their gender. Totally fine if they want to pursue those options, but you can be transgender in any number of ways. Even just not identifying as the sex assigned at birth for an individual is enough to validate and affirm that they are indeed transgender. Does that answer your question?
It does, but so what I'm hearing you say is that a man who's male at birth, and he could dress like a man every day and wear a suit, and he could identify as female and want to be referred to as she or her?
That would be, gender is more fluid too and less fixed. So I think what's important to point out too, and what your question is that gender expression doesn't always have to align with gender identity. So someone can present as a man for their entire lives and still have a different gender identity. And it's always up to an individual where they want to share and present that gender identity and where they feel comfortable. There was something else that was in your question that I was going to address that I lost.
Well,
but is that?
Yeah, I think so. I mean, a good example of that would be Caitlyn Jenner. I mean, this guy was clearly, he lived his life as a man till he was 60-ish. And then we found out through the media that he really always felt like a woman. And then he felt empowered to be able to make that transition to the world as a woman.
Yeah, and I would encourage you too to switch pronouns now that Caitlin, I don't know if I'm saying her name right, but now that she is out as being transgender woman, just to affirm her pronouns.
Did I say him?
Yeah.
Okay, there you go. Yeah, it's tricky. Thank you. Yes, I will.
Yep.
Takes practice.
For sure. And that is another thing too, that anyone can be trans at any point in their lives too, whether or not they're open about it initially or not. Oh, I remember what I was going to say to your another component of your question. So a helpful distinction between sex and gender too is the terms that we use. So for sex, we use male, female, and intersex. And versus gender as man, woman, and non-binary. That just helps kind of distinguish what we mean when we're referencing certain things. So for sex, someone can be male, but also their gender can be trans woman. And not everyone who is trans will identify in that way either. So just acknowledging that sometimes folks aren't as open about that.
Okay.
How about marginalized and microaggression? Have folks seen those terms before?
Well, I'm assuming microaggression is like the same way that I'm mental health. So a lot of people are subject to microaggression, but I'm assuming you're meaning this as it pertains to people who are fluid with their gender and sexuality in the moment.
Yeah, so it's helpful to back up just slightly to go back to marginalized and microaggression can be used in a variety of different contexts. So for marginalized identities, these are identities that aren't considered the norm or don't have power in our broader society. So it can be anything from race to disability to gender identity to sexuality. So for someone who's marginalized, it often means that they have increased barriers towards accessing resources. It might mean that they're not represented in the media very often. It might mean that they don't hold positions of power more generally or as often in society. And so it's really important to consider how the varying different ways that people can be marginalized, which is where intersectionality comes in. So recognizing that all of our identities, they influence each other and interact with each other. So someone who is queer and white doesn't have the same experience for someone who is queer and of color. So race can factor into someone's experiences as being queer. Same with disability. Oftentimes people with disabilities aren't considered even to be sexual beings at all. And so, or they're considered always to be cisgender and straight. And so just being mindful and recognizing that queerness exists and people who are LGBTQIA+ exist in a myriad of different ways too. And so microaggressions are the ways in which the marginalization can kind of show up too. It's these small things that you might not even notice that you're doing. They might seem small to you too, but they do add up over time and over one's day. So microaggressions can be as simple as assuming someone's partner, assuming the gender of someone's partner. So if someone is a lesbian woman and you ask her what her husband is doing, is your first initial question. That's assuming a certain sexuality for her that is not correct. Or microaggressions can also be assuming someone's pronouns when you first meet them. It can be misgendering someone in a conversation. Just those, what seem small and are hard to notice sometimes, but are important to consider when we're thinking about how to create affirming and inclusive spaces.
Interesting. Good explanation, Jess. Thank you.
For sure. Does anyone have any questions about terminology that'd be useful to go over? I think I highlighted most of what I wanted to. It might be useful to point out really quickly that just to kind of give an example and put to use the gender versus sexuality versus sex. For the acronym LGBTQIA+, lesbian, gay, and bisexual are sexual orientations and used to describe those identities. Transgender and two-spirit are more for gender and gender identity. Queer can be used for gender and sexuality, or really a wide variety of ways of LGBTQIA+ identities. Intersex is more meant for just describing sex. There's many ways to be intersex, and it just describes people who are born with variations in sex characteristics that don't align with the male-female binary. And then asexual, aromantic, those are for sexualities, and then agender is gender. And we include the plus too to help recognize that language is very fluid and ever-changing. There are more terms for queerness and LGBTQIA+ people that I didn't include in the slide, but the plus is just a helpful reminder that things always change. And if we don't have any other questions, we can move to the next slide. And I'm gonna grab a drink of water real fast. I'm not used to talking for 2 hours straight, so that's always my issue. So when I do presentations at the university level, I think it's really important to talk about being trauma informed. And my perspective on this is still a little bit university centric. But I think it's also really helpful for thinking about healthcare too, and access, and even just queer experiences in a rural place like Wyoming. Has anyone really come across trauma informed? I think it's becoming more and more widely known about and widely utilized, but I'm curious to see if anyone has come across it, especially more in a healthcare setting.
So at the Wyoming Girls School, this is Sherry Mccoy. At the girls' school, we do trauma informed all the time. That's actually how we take care of our girls and do a lot of work with our girls here. And so that's why it's important for me to do this training actually. And I teach the health class here. And so I actually just went over this portion of sexuality with our girls.
Oh, fantastic.
And we actually talked about your previous slide. We talked about asexuality, bisexual, heterosexual, gender, and where that comes from and what the differences are. A couple weeks ago, that was part of our class. And so, yes, we do that consistently here.
I'm so glad to hear that, Sherry. That's fantastic. If there's anything you'd want to add about being trauma informed, I would welcome that, or I can also just kind of launch more into it. Or if anyone else wants to add anything before we dive into the slide more.
I think I'd like you to explain that a little bit more.
For sure.
Thank you. This is Lorraine.
Yeah, so there's a lot to being trauma informed, but kind of at its core, it just acknowledges that people experience trauma throughout their lives. There's a lot of different ways that people can experience trauma, whether it be just childhood abuse, assault, dating and domestic violence, or even just getting into life-threatening accidents. So acknowledging that in every space that you enter, there's likely someone who's experienced trauma in their lives or who will experience it in their lives. So being trauma informed is just building kind of some core elements into how you try to create the space as being supportive and affirming. So really it's safety, empowerment, and focused on healing. I really like to start with trauma-informed knowledge and like a mindset before we delve further into the presentation. Just knowing that talking about healthcare and marginalization and access for queer people can get a little bit heavy at times, especially when we're talking about barriers to access, discrimination that people might experience, and that sort of thing. So it's important to recognize that while we do this work too, there is resilience too, like how the word queer has been kind of reclaimed and refocused. there's some resilience there too. So it also, being trauma informed also kind of acknowledges Maslow's hierarchy of needs, which I've put on the right hand side too, is that people need to be supported at the very core bottom of the triangle before they can move towards the top. So you need to make sure people are, their physical needs of food, water, safety, shelter are met before they can feel safe and secure. And moving up further, but they need to have that rooted base of the triangle before they can get to feeling belonged, feeling like they belong and feeling loved, towards esteem, towards actual self-actualization. So trauma-informed care just recognizes that people might be in varying different spots on that triangle and have varying needs in the moment, and just trying to meet those core needs before we're able to move up towards the top. Oh, thanks, Sherry. That is a great resource. Yeah, and there's so much to being trauma-informed that it's hard to cover in a training, but I think it's useful to recognize that this is kind of the baseline for what you can put into how you try to create and think about creating affirming spaces. I also want to acknowledge too that for especially LGBTQIA+ people who are trying to access healthcare or who have care needs, they likely will have some past traumas that they're carrying with them, especially in relation to healthcare. It's really hard to access healthcare that doesn't have some microaggressions involved in them. It's really hard to access resources that kind of meet people's needs, especially in a rural area. I know in our state, at least when I went through the public education system, it was really hard to access inclusive sex education, which is why I'm so glad that Sherry has mentioned that they do this at her school. And so just really thinking about every space that we walk into, I think what it means to be trauma informed for me in my work at the university is every space I walk into, I assume that someone also is queer or marginalized in some way. So trying to make things as accessible and as inclusive as possible at the root. And finally, just emphasizing that people aren't only their traumas and aren't only what they experience as well in that regard.
This is Lorraine. I'm thinking that healthcare is a nightmare, and I've been in it for 50 years. I've been a nurse, and but I think there's pockets that are improving. Information gathering at the beginning of an intake has improved a little bit, and so I see some movement there, just not enough because you have all these preconceived notions or old, like you say, habits, and it makes it more difficult. So we really have to train. And I did work as a school nurse for about 11 years and I'm a teacher as well, and in the high schools here in Whiting. And we tried to make safe spaces for students, but it was very hard to get all the staff. It wasn't hard at the small school at Whiting, but it was harder at the general public school because it was hard to change people. So I'm interested in trying to make those things better for everyone. You know, for how do you, I don't say accommodate the people who have no, I say no respect, but you know, who don't understand, who can't put it together. You know, how do we bring those people along? Or do we just have to say, we just have to make those spaces and be available to the people who need us?
Yeah, those are really deep and great questions, Lorraine. I do think that I've seen a lot of increased momentum towards trying to make at least, well, especially healthcare more accessible. There's a lot of recognition that there's work to be done and needs, especially in rural places like Wyoming.
I was in New York, and I was a New York City visiting nurse in the 70s. And I had to go with a friend of mine to just get an apartment so we could have a decent apartment. And they just assumed because I walked in male and female that I was his partner. You know, I was his friend and his partner was a male. But, you know, I think we've come a little bit further, but I don't see huge amount of movement. I mean, that we're talking makes it good.
Yeah, and Lorraine, you just gave a great example of a microaggression too, is when you walked in with your friend who was a man, assuming that you and he were partners, and assuming that you were straight and in a relationship, rather than acknowledging the possibility that he might be gay and you might not be in a relationship with a man that you just walked in a room with. That's a great example of a microaggression.
And he wouldn't have gotten an apartment if it wasn't the apartment. He would have gotten much crummier apartment, right?
Yeah. So one thing too to acknowledge is that marginalization itself, existing as someone without power or much representation or being on the margins of society, that in and of itself is a form of trauma. So experiencing microaggressions, having barriers towards access to healthcare or access towards even renting quality spaces, and just living your life visibly as someone who doesn't fit certain norms of society, that leads to marginalization itself. So that's why it's really important that, especially at the university and the work that I do, we be trauma informed. And I just want to emphasize too that being culturally aware is another really key component to being trauma informed. So like with the term two-spirit, recognizing that for Indigenous people, that knowing what that term means and not using it for people who are non-Indigenous or who are not Native American. And also, I think one of the really cool things about being trauma informed too is that it kind of takes this lens and focuses it on how we can build resilience and strength and agency into our work and into our spaces, and how we can foster good quality community and connections. And so really what I'd like to focus on is really that agency and empowerment, and thinking about ways that we can empower people within their access to healthcare and empower them and give them agency in the decisions that they make, or how they identify with you as providers, or how they are able to even put their identities down on the forms that you have. Does that feel like a good explanation of being trauma informed?
That was good. The explanation, I didn't know the terminology, but understanding exactly what you're saying is easy. Thank you.
Thanks, Lorraine. Yeah, and I think you should check out Sherry's resource. I'm actually going to copy that link for myself so I can have that accessible and check it out later too. So coming from a more university background, I like to include discussion questions. If we feel it's helpful, we can try to answer some of it, but why do you think it is important to be trauma informed? And how does this apply to creating affirming and supportive spaces for queer and additionally marginalized people? So I'd like to hear from you how this might translate into the work that you do, or the spaces that you enter even into across our state.
I think sometimes having a safe space just to listen is because you know that people come with a baggage, and everybody does. And I think that might be helpful when you don't have all the answers. You never have all the answers. But if you provide that space for someone to talk to you without being judgmental, it goes a long way to empowering people to feel comfortable with who they are. That's from my nurse perspective, right? And my teacher perspective, I guess.
Yeah, I think that's a good point, Lorraine. Oh, Sherry, I interrupted you. I just want to say that listening can be hugely impactful, especially for minors who are queer. They might not have people in their lives who are adults or guardians where they can even have these conversations. So even if you do, even if you don't know everything, or even if you do make mistakes like not using someone's pronouns, listening can go a long way. And sorry, Sherry, I didn't mean to interrupt you.
Oh, that's okay. I was just going to say, so at the girls' school where I work, we obviously work with troubled youth, and there's a lot of trauma in their background. So it's important to utilize trauma-informed care so that you understand when they're aggressive, or when they're anxious, or when they're depressed, that there's trauma related to where that's coming from. And so understanding that trauma and where that anxiety is coming from by utilizing trauma-informed care and looking into their trauma, you can understand, or at least get into why they're feeling the way they're feeling, and where those emotions are coming from based on their background.
Thank you, Sherry. I think too, a thing that I'd like to bring into the conversation too, now that Sherry has brought that up, is that for someone who has experienced trauma or who is going through kind of a more emotional response, they can't really move up that triangle until you get them back kind of to a baseline and back to where they're neurologically more regulated and emotionally more regulated. So in healthcare, this might translate to if someone is really worried about going into a rural healthcare clinic where a small town, for example, if they're really worried about coming out as in their sexuality or gender identity, say that they're not really out about being lesbian and they feel that it's needed in their care to receive proper care. And then they experience a microaggression in their provider, assuming who their partner is. Sometimes that microaggression in a healthcare setting, when it seems like you're in a rural place, so the stakes are higher, where people might know you, that might be enough to trigger an emotionally dysregulated response and make someone very anxious and feel like they can't quite engage in the conversation or engage in getting quality care too. So recognizing that might happen, especially with folks who have previous trauma associated with accessing healthcare. So I think it's important just to provide space to acknowledge that sometimes people in settings will act in ways that they might not choose to otherwise, and understanding why behaviors might be showing up in certain settings is really important. Any other thoughts, questions? Okay, we can hop on to the next slide then. So there's this really good article that it's a pretty small study, but it really investigated perceptions of healthcare experiences that LGBTQ people have and have had. It's down at the bottom of the slide if you're curious or want to check it out further. But it really is useful in breaking down kind of 7 different themes in what LGBTQ and queer people experience in healthcare. So I'm just going to run through them really quickly, and then if you have questions or any comments on that, I would welcome that. But again, I just wanted to start with trauma-informed care and perspective before we got into some of this heavier stuff that acknowledges some of the barriers and discrimination that queer people can experience. So for queer people going to get healthcare, one of the first things that is notable is identity disclosure. So for queer people, the decision whether or not to come out to providers can be one that carries certain stakes. Some might be nervous about how their treatment will be impacted if they come out. They might be concerned about how the information will be received. Sometimes it's hard to share information about queerness if you know that this might be documented and not really sure where this information might be shared. So again, keeping confidentiality in mind, especially for minors, is really critical. Secondly, microaggressions and perceived healthcare provider discomfort. Again, this kind of goes back to earlier in our conversation, but these small things that might be really harmful to folks in healthcare settings or in any setting that you might not realize you're even doing, such as assuming the gender of a partner, or when a woman says she's sexually active, immediately assuming that she needs birth control if she's a lesbian, which wouldn't be the case necessarily. Participant vulnerability and risk was another thing in this article. Just recognizing that coming out to a healthcare provider as being LGBTQIA+, it can be really vulnerable to people, especially if you're just meeting a provider for the first time, or if you don't have a really long-standing relationship with them. And the risks that they might fear goes back to identity disclosure and how they might be perceived as well. Needing to advocate on one's own behalf too is a really important thing to think about. For LGBTQIA+ people getting healthcare, it can be really exhausting to feel like you constantly need to explain who you are, or you need to correct people who misgender you, or you find that a provider isn't aware of terminology or nuances in LGBTQIA+ identities. So that's another thing that LGBTQIA plus people can experience when receiving healthcare, is just the exhaustion of constantly needing to advocate for oneself.
You know, I think, this is Lorraine, I think there's a big double standard, because in a social setting, in a medical setting, I know what happens, and it can be awful for people, and we have to be very conscious of it, because we just have this stereotypical thing that happens. And I mean, I think it's getting better, but anyway, but in a social setting, I don't say, my name is Lorraine Celino Klein, and I'm a heterosexual old gal. You know, I never do that. So when somebody's introducing himself, I mean, I'm interested in their pronoun, but I'm really not interested when I'm getting introduced. Can I just accept you for who you are at that moment in discussion? You know, I mean, if it's going to be a problem, but I guess we don't present ourselves, so it's a double standard, and I don't think it's fair that we judge people. I mean, I don't know what I'm exactly trying to say, but I just think it's some kind of strange situation that we're in.
Yeah, Lorraine, I don't know if I am quite understanding what you're trying to say either, other than just to acknowledge that our society makes it hard to get things right with pronouns, with gender identity. We don't provide spaces very often for people to just be able to acknowledge who they are. Like even just meeting someone in person, the thing I like about Zoom is that you can add your pronouns pretty easily to your profile. So that's really easy for people to access. But it's harder when you're meeting someone in person. There's so much information that you're getting all at once when you're meeting a new person. Like even remembering someone's name can be challenging at that point. So I think that,
for me.
I think that, yeah, it's always challenging to me. I think that just recognizing that this is hard to do and hard to do correctly all the time. And even I make mistakes constantly. So learning how to apologize to in a way that doesn't make everything all about you, but acknowledges the harm too that you might have caused. Even if you didn't intend any, it's just, we have grown up in a society that has made it hard to be inclusive outside of healthcare situations even too.
I agree with that. It makes it hard. And you don't want to put your foot in your mouth, but then, you know, you're, like you say, these patterns, and we don't have other languages have vocabulary, but ours is very stilted. And we don't have words that we have used before. Right? Well, I don't know. I just, it's difficult, and I'm sorry for people that are in that position where they're always having to, I mean, I think that must be so traumatizing, which we talked about, that trauma, to constantly have to differentiate yourself from others.
Define yourself? Is that what you mean, Lorraine?
Yeah, why? I mean, I never have to define myself. I just say, hello, I'm Lorraine, you know, nice to meet you. But we're in a different situation now. And I guess that makes us get fumble when we don't really want to fumble.
I think it just highlights too that we need to be careful about the assumptions that we make too. And really being critical and challenging ourselves too. And just opening space for apology and correcting yourself when you get things wrong. Because it happens, and I think many people who are not cisgender and not straight acknowledge that it does happen constantly. Doesn't mean it's any less harmful or less exhausting, but it's just larger faults with our broader world. But one thing you can do too is just going back to, when you introduce yourself, share your own pronouns and give space for people to share theirs. If you have name tags, you can put your pronouns on your name tags in your email signature. And if you're not sure what pronouns someone uses, you can just keep using their names too. That's a useful fallback. It can get a little clunky, especially if your name has more than one syllable, but that's always a good fallback if you're not sure.
So how do you do that? How do you put on your name badge? I mean, like you have your name there that says Jess, and then they / I can't see the rest of it, but is that what you should be doing? I mean, does that make somebody feel more comfortable? Because I mean, that's so easy to do. if, you know, for something to make people feel comfortable right away.
Yeah, I would say that I would encourage to do it if you feel comfortable adding it in, just because it opens space. So you can rename your profile pretty easily on Zoom. You just go to your little square on Zoom, those 3 dots, and then it should allow you to rename yourself. So a lot of the times what people do for their pronouns is they put their name and then they put the parentheses. Mine says they, them. You can do whatever your pronouns are, she, her, he, him, his. That's a good way to put it in there, and just make space for people to share their pronouns if they want to. On your name badge, what mine says is just falsing, and then underneath it says pronouns, whatever the colon, pronouns, colon, and then they, them, theirs, separated by slashes for the they, them, theirs. I also think it's a good point to say that I personally think that pronoun sharing should be optional, because if you don't make it optional, you risk outing transgender people if they don't want to share their pronouns, or you put them in a position where they have to misidentify themselves. So for someone who is a transgender man, he might be presenting more feminine in the space. If you make sharing a pronoun required, he might have to either say she, her, hers, which would be not true to him, or out himself. So that's why I like to make pronoun sharing optional. But there's a lot of use in sharing your own pronouns if you're cisgender, or sharing your own pronouns in the space of being a provider, recognizing there's often a power imbalance between providers and people seeking care. Okay, so back to the 7 themes. We also have overt and egregious discrimination by healthcare providers. This is pretty self-explanatory and obvious. The good thing, well, not good thing, but the helpful thing about overt discrimination is that it's easier to acknowledge when it's happening and to recognize when it's happening. That said, always make sure that you acknowledge that impact is more present than your intent in anything you do. So how someone's impacted by your actions is what matters over whatever your intent was. This sort of overt discrimination can be something like a provider absolutely refusing to use the pronouns of someone, even after this person has said their pronouns multiple times. It could also be how HIV positive people are treated in healthcare settings too, for some examples. But moving more towards the positive side of things, more normalizing the patient's sexual and or gender identity in healthcare spaces, just recognizing that we all have sexuality, we all have sexual orientations, and we all have gender identities, whether or not you're cisgender, straight, or LGBTQIA+. And so normalizing that into someone's care and not treating them like they're some sort of huge anomaly for being LGBTQIA+. And then humanizing the healthcare encounter is just one step beyond that, more towards active affirming of someone rather than just mere tolerance.
If you're afraid to go to healthcare because you're afraid that your information won't be confidential or you'll be made fun of, you get neglected with healthcare. And that's a really serious issue that we deal with all the time.
Yep, and I think it's good to acknowledge that too, that that's definitely a barrier for many LGBTQIA+ folks, especially if they're in Wyoming and they have to travel far to get inclusive care. That can be another barrier if you don't have easy access to transport, or in the Wyoming winter, we all know that the roads shut down constantly, and so on. Is this insightful to kind of cover and go over? Does anyone have any questions or thoughts on these themes?
I will say it's very helpful to be reminded of just the emotional barriers. Yeah, it helps.
Yep. Yeah, and that's a good point, Maggie. It can be really anxiety provoking, to put it even on the lighter side, for someone just walking into a healthcare setting. For some folks, that in and of itself is really just anxiety provoking. I get that. It's just white coat syndrome. But then on top of that, if you're marginalized in any way, or if you feel like you have to navigate any of these barriers or constantly advocate for yourself. That's just gives more perspective on what LGBTQIA plus people might be experiencing as they come into your clinics or as they come into your spaces as they seek your care.
Mm. Yeah.
I think one thing that we hear quite often from providers is that they don't see this as a high priority issue because we aren't treating these populations. And I think that what actually is probably happening is these populations aren't comfortable enough disclosing this kind of information, and we're not collecting it regularly. And so that's a really big barrier that I think that we need a lot of help with, is normalizing that patient sexual and gender identity, because right now it's like we have a lot of providers really in denial.
Yeah, I think you're exactly right about that, Angela. It's just underreporting for any variety of reasons that might be the case. But also in Wyoming, we just don't have a lot of data on LGBTQIA plus people in the state. It's just so rural that it's hard to access this information sometimes. But there are quite a number of queer people in the state. I can definitely assure you of that, and we exist everywhere too. It doesn't matter if it's just one person, even in one town, who is queer. Oftentimes it's much more than just one person, but regardless of numbers, it's important still to make sure that person feels like they can access quality care.
Yeah, absolutely. And one thing that we have found is like now Epic has this whole tool built in for these populations and to collect this information. And a lot of health systems in Wyoming have Epic, but we're finding now that it's getting like handed off to so many clinical teams that it's just not getting recorded at all. So like admissions, quote unquote, isn't comfortable with doing it. And the nurses, quote unquote, don't have the time, and the providers don't have the time. And so it's just, it seems like it's getting passed off. And so I think we have maybe 5% getting collected, and that is quote unquote at the provider and the clinician's discretion, whatever that means. So I guess we just don't know how to make everyone comfortable with discussing the topic.
Yeah, I don't have a good answer for you there either. Other than just to acknowledge too, on the flip side of that, well, I think it's really important to acknowledge, backtracking slightly, that it's hard to navigate as providers some of these barriers yourselves in healthcare and just quality care in Wyoming in general. But also for LGBTQIA plus people on the receiving end of care, just fear of sharing information for the sake of it being confidential. That's often a barrier that people experience, just not knowing where this information is going to go, not knowing who it's going to be shared with, not knowing how it's going to be represented on their file. That's another reason why it's hard to collect data. Oftentimes it's just a lack of trust from previous experiences often, which is totally valid and totally understandable, but it's just another layer to this.
Yeah, absolutely. Have you had any experience with health systems that use the pronoun buttons? I know that that's big in Colorado and something that I tried to pitch here, but like I said, I got met with, it's not really applicable to our population. So I was just wondering if that's something that you've had experience with.
Are you talking about pronoun buttons in forms or like as more like physical buttons?
Like a physical button on so the healthcare providers would wear them. I know that UC Health does that. And I actually have one from UC Health, but it just says like she, her, hers are my pronouns, or they have like my pronouns are ask me. And they have found at least in their health systems, that it kind of opens up and makes the conversation a little more comfortable.
Yeah, I would really imagine it would, Angela. I think that's a great idea. I unfortunately haven't seen that in Wyoming much. I do know that I did a presentation specifically with healthcare that they were open to that idea of doing buttons, but they were limited more towards using stickers instead of actual pins. But I think it's a great way to just more normalize sharing pronouns, and a good way to even just share your pronouns as a provider. And I'm sorry that there's that resistance towards assuming that we don't have a high population where that would benefit.
I just wanted to say something real quick before I have to head out and do clinic. I think in Sheridan, we have a pretty significant population of LGBTQAI plus. And my daughter, when she came to visit last summer, was a little concerned about Wyoming being one of the densely or low populated states because we came from the DC area. But her and her now wife came out here and were very well accepted in the Sheridan area and did not feel uncomfortable at all. Were able to be openly gay in Walmart and did not feel shunned or unaccepted or anything walking down the street, being together. And we actually do have a pretty good population of gay and lesbian couples in the area that do have kids even. So, and we've had a couple parades. And hopefully until COVID hit, which kind of put a shutdown last year's, and hopefully we'll have more in the future. And I believe that we've taken our girls down there in support of those. Because some of our girls relate to that as well. And so we support whatever their gender sexuality is and encourage what they relate to, as well we should. Because that's who they are. And we should always encourage who they are and support that in every way that we can. So I just kind of wanted to share that a little bit. I have to run off to clinic, but I want to thank you, Jess, for everything. You're doing a phenomenal job. I love this training, and I'm going to actually download the slides. And I appreciate the training. Thank you very much.
Yeah, for sure. And thanks, Sherry, for chiming in too and joining. And I really appreciate your perspective as someone who does trauma-informed care. And I think too that Sherry just brought up a good point, not to try to encourage you to stay on, Sherry, sorry, just about, we do have a lot of queer people in Wyoming. We have 21 before COVID. We had, I'm not sure if the numbers changed just because of how difficult things are and how schools have been impacted, but we have 21 GSAs in the state, which are gay straight alliances, which are essentially clubs for students who are LGBTQIA identified or who are allies or who are otherwise exploring. Just a club for them to have support in schools and to know each other and be together and find community. So we have a significant amount of GSAs in our town or in our state. I think a lot more young people are having access to education and resources that affirms that LGBTQ identities exist and what they are, and that it can look any number of ways, and just more information and more terminology and more widely accessible media representation and all of those things just make it a little bit easier to find yourself as someone who's LGBTQIA+. And so I definitely can attest to there are several LGBTQIA+ Wyomingites. Part of the issue might be that they're just not always comfortable identifying in certain settings, or even just in healthcare settings specifically too, just going back to the difficulty of data collection.
I'd like to say that Laramie High School is pretty good in doing that, and they had little buttons that you put on your door that said you were a safe space, you know, and it was green with this line, pink line or something, but you could put them on the door, the outside of your door, so students would know that your classroom was a place that was comfortable and safe. And in Whiting High School, they had some transgender kids that were doing okay. You know, I think the younger generation is having a much easier time with this than the older folks. You know, I think that's where we see issues with the, you know, older folks trying to change their bias and their habit, as you said, right? And younger people just have more I mean, I can't, we never say all, but I think it's easier. And when you have something with this Gay Street Alliance in a school, it really promotes an attitude of acceptance. Very important to do. And we should do it in more places, actually.
Yeah, Lauren, I think that's all really good. All of what you said is really good and valid. I think the access to the internet has hugely changed the situation for queer folks too, especially the younger generation. And it can't be overstated enough how much it can mean to have a supportive older person in your life who you can turn to. It doesn't have to be your parent or guardian. It can be a teacher at your school, be a role model who is queer. It can just be someone that you know that you can reach out to and have these conversations with, or know that who has your back in these situations too.
It can save a life.
Yeah, absolutely.
Life. Mm-hmm.
Any final thoughts or comments before we switch to the next slide? Okay, I think we're good to switch. Thanks again, Devin, for navigating this. It's always an interesting adventure over Zoom. So I think we've talked about this already a little bit, but just acknowledging that we're in a rural place. Wyoming is the least populated state in the union. And that's important to acknowledge. People have different experiences here in rural places than they do in urban spaces. I think it's really important too to acknowledge that when we talk about rurality, being from a rural place and living in a rural place is itself a marginalized identity. So we need to talk about rural places with care and make sure that we're not further putting them down or further assuming certain things about the spaces. Just because someone's from a rural space doesn't mean that they aren't smart, doesn't mean that they are lesser than, doesn't mean that they're trapped in their situation. People choose to stay in rural places for any number of reasons. And that's just as valid as of a place to be as an urban space. Something that can be a little bit difficult to navigate, especially for queer people in rural places is just the notion that we don't exist. This is kind of goes back to what Angela was saying. But there's this pervasive kind of narrative that in order to be accepted, someone who's LGBTQIA+ has to leave Wyoming or has to leave a small town, which can be the case for some people. They might feel like that's their truth, but it's not nearly the case for everyone. There are people who are queer who exist in rural spaces, and we choose to stay here for any number of reasons, between just really enjoying the public land, like this picture here, or having family in the area, or any number of reasons. One key component, though, to acknowledging the importance of the place that we're in is just access to healthcare in Wyoming generally can be hard for anyone. Just knowing that we're rural, getting access to specialists can be hard. Even growing up in Rock Springs, which was a town of about 20,000, oftentimes we had to go out of state to Utah to get healthcare. And so lack of resources can make it hard, especially lack of people, or a lack of education too can be another barrier. And also a lack of education in terms of even just public health kind of components for queer people. So a lack of inclusive sex education might be one, or a lack of even just information about how to have healthy relationships can be one. So, and also knowing where even to get access to hormones can be a barrier for people who are trans in Wyoming too. Most often people have to leave the state to get that kind of care. And my notes just went away. That's okay, we'll deal with it. Another component too is that in small places, people tend to know everyone. It's really hard for me to go into a coffee shop prior to COVID in Laramie without knowing at least one person there in the coffee shop. This can be really hard when you're not in a place in your life where you feel like you can be out as LGBTQIA+, or you can be affirmed in that identity, especially if you're a minor. Just small places, feeling like everyone knows you, that can be hard. Especially going back to confidentiality and just not knowing all the time where this information is going to be shared, or just having that small fear in your mind there too. It's just also important to recognize when you're in a rural place that place, identity, and history all have importance. So in Laramie, just acknowledging the legacy of Matthew Shepard is something that I do a lot, and I think is important to recognize the history of what happened there and how that might impact the people who live there today. And just acknowledging too that, you know, rurality has its own culture oftentimes too. And I know that we've kind of went over this a little bit throughout our conversations too, but something that I like people to think about is like, what does it even mean to be LGBTQIA plus in a rural place? And especially, what does it mean to be seeking care in a rural place? How might that impact the kind of care people receive? I know that we've talked about this a lot, but I encourage folks to chime in with their thoughts or even what they've seen on their side.
If you don't think there's a population, then you don't even consider providing care or asking the appropriate questions or making a safe space because you think that isn't even around, right? I mean, it becomes a huge barrier for people to get what they need or to be accepted for who they really are because we say, oh, that doesn't exist here, right? I mean, I think that's a big issue.
Yep, I would agree with that.
I know that we don't tend to have very specialized care for a lot of things. And so that might be a deterrent for seeking care here in Wyoming, is the fact that we don't have that specialized care for that specific population.
Yeah, you could, and also you could not be asked the proper questions or be screened for things that, if your gender is assumed and your gender is different from your sex or your sex organs, you could be like not screened properly for certain diseases or things like that.
Absolutely. I've heard experiences too where lesbian women aren't screened for sexually transmitted infections because it's assumed that lesbians can't have those, which is incorrect.
I know when I used to work for the state of Wyoming, I actually worked for the sexual health program, and we saw that all the time. And they never did 3-site testing either. And so a lot of providers were only doing 1-site testing and not testing for the places that people were actually having sex. And so that was getting missed in a lot of places, but it just came down to comfortability on the provider's end with doing that. And so I think if people want that kind of more well-rounded care, they haven't gotten it here in the past, it deters them from seeking it out here now.
Yep.
And I must say that Wyoming has a propensity to say, I mean, my late husband was an internist, and people were great at saying, oh, in Wyoming, our healthcare is different. We don't have that. But a heart attack is a heart attack, and a person with gender issues has the same kind of problems as they do anywhere in the country. But we happen to think that we're unique. And I think that puts people in a bad place to get the kind of care that they need.
Yeah. Yeah, and I think that just emphasizes that for people who are coming into the places where you provide care, they probably are likely to carry some form of an experience with this or some form of trauma. So just going back to the importance of being trauma informed. And I think a lot can be done too, and just acknowledging that sometimes we don't do a good job here in Wyoming with providing care, and just acknowledging that reality rather than trying to pretend it doesn't exist. I don't think that's the end all be all solution, but I think that also goes a way to just affirm that these are experiences people have in our state. Does rurality come up often for you in your practice? Is it something you think about a lot? More curious. We have conversations about it a lot at the university. So it's something that I think about all the time.
What's the question?
What's the question? Yeah.
Yeah, sorry. So do you think about rurality a lot, or does it come up a lot in just like how you think about your work or conversations you have, or just like questions or acknowledging where we're at?
Are you saying rural or are you
Yeah.
saying, okay, thank you.
Rurality.
Thank you.
Yep.
Well, yeah, we think we're so different because we're so rural, but the same issues come up. You just don't see hundreds of glioblastomas, but you do see them, you know, and you don't see, you know, the quantity isn't as great, but you still see it in the same proportions to our population.
We certainly think of rurality a lot in terms of access in general, because especially with COVID, we've had limited access, and we know our patient populations have as well. So just trying to create more avenues for them to access care, especially with telehealth, but also getting people more comfortable on telehealth, because it can be harder, our clinicians have found, to build that rapport over a virtual setting.
Yeah, for sure. And I think, Angela, that's a really good point too, of just how the pandemic has shaped our world. COVID often has disproportionate impacts on people who are marginalized. So for people of color, or for LGBTQIA plus people, they see more health implications. It also puts different barriers on them that then might otherwise be seen with the supposed normative population that's not LGBTQIA plus. I've seen a lot with my students, even that they're in spaces that they wouldn't be in otherwise, especially when the university went remote. Some of them had to go home. So the physical places they were trying to Zoom in from weren't always affirming or accepting. And I would assume that also impacts telehealth too. While telehealth does have many advantages of providing access towards people who can't travel, it also, there's that whole new consideration of access to technology and access to literally safe spaces to be Zooming in from.
Yeah, absolutely. It's definitely been a barrier.
And unfortunately, that's not an easy fix either. But I think it's important just to acknowledge that COVID has definitely had an impact, and also a disproportionate one often on marginalized people.
Well, that's because they didn't ask the right people. Sorry, but if they had asked the right people, we would have put some of that federal dollars into at least giving people access to, you know, internet.
Truth. Hey, if we don't have any other thoughts or questions, we can move on to the next slide. Also, to acknowledge, if you have any questions relating back to the earlier parts of the slides, you can totally ask them now. That's more than fine. So I'm going to turn on my computer again that has another copy of the slides because it turned off. There we go. So this is my last slide before just opening space for some discussion, questions, and reflection. I like to end on a note of resilience, and this kind of goes back to your question, Maggie. Just diving more deeply into what queer means and how we can focus on resilience. If anyone wants to read the quote that's on the slide, if they can read it, it gives me a break from talking, so that would be fantastic if we have a volunteer there.
Of course, I'll volunteer.
Yeah, I can't see it.
Okay. Not queer like, excuse me, not queer like gay, queer like escaping definition, queer like some sort of fluidity and limitlessness at once, queer like a freedom too strange to be conquered, queer like the fearlessness to imagine what love can look like and pursue it. Brandon, by Brandon Wint.
Thank you, Maggie. I really love this quote. It's by a spoken word artist. it just kind of expresses what queer means to me. Queerness is a really broad definition. It's very fluid. It really challenges these societal norms and notions that we've been taught that teach us there's only certain ways to exist, that gender is fixed and binary, which is not correct, or that or the assumed that notion that only cisgender people are valid in their identities either, which is not incorrect. Queerness also opens up the freedom and limitlessness in who you love and how you love too. And so I really like to just kind of end with talking about queerness and resilience, especially as we've talked about barriers and lack of access, and just give space to acknowledge that there's been a lot of work with reclaiming this term, and there's a lot of resilience even in queer people in Wyoming. We have people who plan Pride celebrations every year, albeit somewhat impacted by COVID. We have people who lead GSAs and are student leaders in their high schools or at the university. We have people who are constantly challenging Wyoming to become a place that's more affirming and more inclusive. So just because the situation looks as it does now doesn't mean it always has to look that way, and it doesn't mean that people don't have agency, which is a lot of double negatives. Also, please ignore the values-based bullet point that's more university specific that I forgot to take out for this presentation. But we already went over a definition of queerness, and just to acknowledge that for many people, queer is still charged politically and has those connotations of derogatory history. So not everyone really resonates with this term, but it can be useful to really just challenge ourselves to be critical of these societal norms and just acknowledge that all of these things are fluid too. Another point to emphasize is person first language. So whenever you use the word queer, always attach it with a noun. Queer should be a adjective. Yeah, adjective. So say a queer person, not just a queer, and leave it at that. Making sure that we put people with identities. So similarly, person of color is another thing example of person first language. Also, this applies to terms like transgender, like make sure you are using it as an identity and descriptor and put people with it. So a transgender person, transgender woman, don't just leave it at a transgender. This just helps bring back humanity into the conversation and acknowledge that people are people at the end of the day. And also, again, another note to just make sure you're using the language that a person uses themselves and meet them where they're at and provide space for them to self-identify. And I'd like to ask this question about how queerness might be resilient. What does that mean? What does that look like in your spaces, and what does that mean for providing access?
Resilience always seems to me like someone who survives and manages because they're able to deal with the situations that come their way. Sometimes the only way they can is in a rural area where nobody's accepting is to just be quiet about it. Other times their resilience allows them to survive in whatever area they're in, right? That's what it seems to me. But you have to be really resilient to live in this world. In some countries, just if you're a woman, if you're in America, if you're a woman, right? You have to be resilient if you're a person of color. So I'm thinking that resilience means you have to survive in the area that you're in, and you work hard the added stuff is you can work hard to make it better, to make it more acceptable, but you're surviving. I think it increases your corticosteroids if you don't have enough people to help you, and it's not very healthy, enough support structure around you.
Yeah, I think that's a good point, Lorraine. Just recognizing that sometimes survival in and of itself is a huge component of, is something to celebrate. And there's no one way to survive being queer in Wyoming, and there's no one way we should tell people how to be queer in Wyoming. So if that means for someone that they don't come out to you as being LGBTQIA+ when they're in your care, that's fine, that's their decision. And that's why it's important to just try to build in as many inclusive and affirming things as you can just in your day-to-day, just because you might have someone in your care who won't come out to you, or who doesn't have the chance to either. I think another note about resilience too is that there can be real joy too found in being LGBTQIA+. There can be joy in being queer in Wyoming. There's a lot to celebrate too. I've noticed the community here is something that really keeps people staying here, those close connections that you can make too. And so just going back to being trauma informed, we're not just all of the traumas that have happened to us. There's really much more to it than that. And so queerness, while it does provide some challenges to access and challenges to barriers, it can also provide beauty and joy and resilience and resistance too, which is why I like to end on that note and just remind folks that there's still good in the world, even though we just talked a lot about the challenges and barriers.
I have one more question. I'm sorry. You say LGBTQIA so rapidly. Is there a general term that you can use or is that the general term?
So
a little easier for people to kind of still grasp. I'm sorry.
No worries. That's a good consideration and good question. I mean, I myself have a hard time always saying the acronym just because it's a lot to say. What I often do is switch it out for queer. I know that's not always the best option, especially if it's not a term that someone likes to use. Some people will just shorten it to LGBTQ if you find that you just can't get those other acronyms out, or those other letters out. The reason why I expand it as much as I can is just to try to be as inclusive as possible and to acknowledge all of the identities that I can. The advantage to queer is that it does sort of act as that plus. So if you leave it as LGBTQ, that will say most of what you need to say. But I hear you in that it's a mouthful.
Thank you.
Yeah. Hey, Devin, if you want to switch to the last slide. So here's a space where I just like to open it up for further questions or further discussion, and also to give some practical tips on what you might be able to do in your situations. While I do have some experience in being queer in Wyoming and also doing the work that I do, I don't know what your spaces look like specifically. I don't do your work day to day. I don't know where you're at geographically, what your communities look like, and I'm definitely not a healthcare provider. So I like to add space at the end to just process the presentation, the training, and to just talk through what might be helpful for your space. And also Devin just put in the survey link.
I have been making a lot of surveys recently, and I've been trying to, in the demographic questions, ask the demographics in an inclusive way, but I've been seeing some differing research. Do you have like kind of a rule that you generally follow, or demographic questions that are inclusive and up to date, but not maybe like 15 slots long?
That is a brilliant question. There's not one huge consensus overall for this, which is makes it not super easy. I do think some of the most basic things you can do is make sure you're listing gender and sex separately. So making sure that you have a place for people to identify both terms and not conflating the two. I know I see all the time on forums, they'll conflate it and say the question will be gender : male or female, which the question should actually be gender, man or woman. And so if you just leave it at conflating the question, you don't get all the information about someone's gender identity and sex. That might be helpful for you to know. The other good rule is not to leave it at a binary option. So all the time I encounter surveys that just leave it as my only options are to do men or women, and I can't choose any non-binary option, which isn't ideal to say the least. So making sure that you either have a third option listed, or the brilliant thing you can do is even just leave a fill in the blank. I do that a lot, just even a basic survey tool just to get information that I might not have thought about asking previously. Yeah, and just allowing people to self-identify as much as possible, I would say is a good thing. Asking for pronouns too is another great question to include on your forms. Pronouns don't always neatly align with gender. So someone might be non-binary, but also at the same time just use her pronouns for whatever reason. And so gathering information about someone's pronouns, this is more general, not specifically for like survey tools, but even in your forms that you use in your day-to-day practice, that might be a helpful thing too. But yeah, terminology shifts so rapidly, and there's so many different terms that it's hard to give any sort of firm, this is what you should be doing, these are the absolute best practices that everyone follows. I hope that answers your question, or at least provides some insight.
Yes, thank you so much.
Yeah. Another thing on forms too to think about is how you ask for people's names. I know that legal names and insurance gets complicated, for insurance being complicated because it can never be easy. But just making sure you have an option for someone to list a name that's not their legal name. So for trans people, their name might not be their legal names. It might not align. Some forums will list this as a preferred name option, which is kind of a good catch-all if you want to try to ascertain someone's nickname or to ask for what someone's name is without specifically giving it away that you're trying to ask for them for the sake of not knowing whether or not they're cisgender.
I actually think I see that. I'm sorry to interrupt, but I actually think that I'm seeing, what would you like to be called on forms now that I've never seen before. So I think that's a good step, because we're saying, what do you your name is Lorraine Salino Klein, but what would you like to be called? I think that gives people a clue that, maybe we can be true to ourselves, maybe that's my fantasy, but I like to believe in positive change.
Same here, Lorraine. And I think too that just giving an option, it helps people who are more than just queer people who might be divorced and not have their name changed legally too, any number of reasons. I like to stay away from asking people preferred pronouns or preferred names, because pronouns and names aren't something that is a preference, and it's not. Preferred implies that it's optional whether or not to use them. So when I'm asking for pronouns, I just ask for what are your pronouns. And then for names, it gets a little bit more complicated on forums, but you can ask for someone's affirming name versus their legal name, or just ask for their legal name and then ask if there's another name that they would like to be called instead. Another thing to think through is your bathroom situation in your physical spaces. Do people have an option to use the bathroom that's not gendered? And if you have single stalls, I would encourage you to just not gender them at all. Gendered single stalls are kind of useless in my opinion. But thinking through physical access to your space is another thing that you can do. It might not be in your control just to acknowledge that.
But when the hospital redid, I noticed that a lot of the bathrooms are just restroom. Yep. And that's been very nice.
And another simple, if website design and development's not really simple, but another small thing you can do is add a resource tab on your websites if you have access to that, or think about how you can physically display resources for LGBTQIA+ people in your physical offices and spaces too. That seemingly small part can go a long way. One really critical question that I like to just ask and get people thinking about is, how will LGBTQIA plus clients know that you're creating an inclusive and affirming environment? What does that look like? How will they know without maybe you even saying anything? Or how will they know when they first walk into the building? How will they know in your appointments? It's not an easy question to answer.
In the classroom, we had those little buttons on the door, but yeah, I go to people's homes, so when I work, and I don't know what they do in the downtown clinic, but maybe I'll ask and see. I know that people are pretty open and very caring there, and so I'll have to see what we do. Do you have any suggestions?
Way to turn the question back to me. I'm going to grab a drink of water and think on that for 1 second. I will say that for physical indicators of safe spaces, just to challenge you to think about putting a sticker on a door doesn't always mean your space is safe. It's a nice cue towards acknowledging that you're thinking about it, acknowledging that you might have taken trainings on it, acknowledging that it's important to you, but just be cautious and know that safe and affirming and inclusive spaces are also about the actions that you do within them and the conversations you have within them and beyond just those physical indications. I will say though that stickers can be useful. I know that several clinics in Laramie have pride flags, which is another useful visual indicator. On Google Maps too, I don't know how you get it added, but you can have an LGBTQIA plus friendly indicator with a little pride flag on there too. Don't know how Google Maps works, but I've seen that. And even just those small things like having pronouns in your name badges, if you wear name badges, sharing your pronouns when you introduce yourselves, having a resource tab on your website, or just resources, physical resources, pamphlets in your office spaces too.
I wrote them down. I'm going to take them to the clinic and see what we can do. Maybe it's already done and I don't know it.
Thank you, Lorraine. And while I'm thinking of it too, I'm going to put my email in the chat one more time because it came to me. Feel free to reach out to me anytime. Angela and Dana, I don't know if I'm saying your name right, but if you want to be more connected with Wyoming Equality and their healthcare access project, I'm happy to make those connections happen. And I'm pretty sure they'd welcome your insight and more support in doing that.
It would probably, when you send the slides, they'll have your contact information on it too, won't it?
Yeah, it's in the slide where I have my pup on screen. So.
I'm not clever enough to get it out of your chat once you close out. Thank you.
No worries. Yep.
Jess, I'll send you an email after this and to get that Wyoming Equality information. Thank you for offering that up.
Yeah, absolutely. And no pressure to take me up on that. I just know that it's a resource that we're trying to get off the ground, and there's no sense in trying to double the work when we're in such a small place.
Oh yeah, absolutely. I completely agree.
Oh, and the Equality State Policy Center is what you're talking about. They are fabulous. So they're worth participating in.
Yeah, equality, what you just said, Lorraine, sorry, I'm running out of words. It's been 2 hours. That's a different resource than Wyoming Equality. Wyoming Equality, I just put the website in the chat, but if you just go to wyomingequality.org, that's their website. They're one of the only 501c3 nonprofit advocacy groups in the state. So they do everything between keeping an eye on just what legislation is being discussed to trying to connect LGBTQIA plus minors, youth to resources wherever they're at, towards doing just some programming just to have queer spaces across the state. So they're a really great resource to connect with. And I know that there's been some focus on trying to increase access to healthcare too.
Well, thank you for correcting me and clarifying.
Yeah, for sure. But the or the equality policy, yeah, I know what you're talking about. I can't say it. They're a great resource too.
It's Equality State Policy Center.
Yes, yeah.
It's a mouthful, like LGBTQIA is mouthful, right?
Yep. Important mouthfuls, but challenging sometimes. And then Devin, I think I have one more slide for resources if you want to just flip over there real quick. I would encourage you to continue thinking about the reflection questions, just simply because they're so hard to answer. And I think they're useful in practice when you're thinking about creating, affirming and supportive spaces as well. But these are just some resources that I've listed. Again, there's the article about perceptions of healthcare experiences, trans student educational resources. The trauma-informed resources I have are more specific to higher education, so they might not be as applicable here, but I know Sherry put a good resource in the chat earlier. And then Trevor Project is my go-to resource. I love all of their information. They have really comprehensive resource guides, a glossary again, just really good resource to check out too. But I will provide a little bit more space for questions or thoughts or comments, because I know I'm one of those people that takes a moment. While you might be mulling over things, I just want to thank Carolyn and Devin both for helping to organize the training. Another huge thank you for running the slideshow. And Carolyn, thank you for your first outreach. And thank you all for coming too. This is important work, and I'm glad to see that we had so many folks on the call today.
I'd like to just say thank you. Thank you for the slides and everybody that helped you put this together. It's been really informative and very helpful, and also just to make us think about, or at least me, speak for myself, me to think about how I can improve care and how I can reach out to people and give people what they need to be comfortable in this crazy world we live in. So thank you very much. I appreciate it. I have to sign off. I've got somebody hammering here, hanging out pictures for me. So I appreciate it. I've got to help them a little bit. So thank you.
Yep, thank you, Lorraine. And then Devin, I just have one more picture of my dog if you want to show it, just because Eli's cute. That's Eli. Look at their ears. They have such big ears.
So cute.
Dogs make everything better.
They seriously do.
All right, well, I'm gonna stop the recording here, and then